This segment of DelmarvaLife is sponsored by TidalHealth.
When most people think of their healthcare professionals, they might think of doctors, nurses, maybe even first responders. For some reason, that thought doesn't always include social workers. Social workers are vital to the healthcare system.
They sure are. Whether you're in need of someone to help with a mental health crisis or to aid your family in the time of need, social workers are there for you. Now, if you're not sure how social workers can help you, TidalHealth has answers to your questions. And here to answer some of those questions is Meredith Phillips Woodard and Allie Thompson. They are both social workers with TidalHealth. Thank you both for being here this afternoon. Okay, so it's actually Social Work Awareness Month. So what does social work mean, or the awareness of social work and having a month, what does that mean to you?
So it's exciting because, again, a lot of people don't know that social work is part of their healthcare team. A lot of times we're in the background doing a lot of things. Sometimes we're right up front doing things with people. So some people don't always know that there's a social worker in the healthcare team working on things for you. Whereas in mental health crisis and in crisis situations, they're right up front. So we're always happy to have our month, right, to really talk about our profession and to engage with people about it.
Sure.
So what's your role or responsibility when there's a family that's in crisis?
So many things. We do mental health counseling. We are LCSW, so we are mental health professionals. So we see people to do one-on-one counseling. In the cancer centers, we do 3 free counseling sessions with patients. Try to also support the caregivers for those patients. We've both worked in case management as well at the hospital. And so in that setting, and also in the cancer setting, helping people with financial resources, home health setup, medical equipment setup, linking people to resources, and trying to have the patient advocate for themselves, empower them.
Yeah. And Allie, I was going to ask you, so you work alongside the other healthcare providers?
Yes, we work with the nurses, the doctors, the dietitians, research professionals, radiation specialists. So we kind of work as a team to figure out what's best for our patients, what they need, and we're there to motivate them, encourage them, as well as offer that support for them and their families.
Nice.
Yeah.
So the social aspect is important to overall health. What do you do in that regard as far as helping with the social?
You know, you have the mental health piece of it, you do have the social piece of it, you have the emotional piece of it, and you have the physical health, and trying to get patients to engage in those social ways does improve your mental health. So if they have a church family, if they have things that they like to do, when you're sick, you don't always have the ability to maybe physically run or do pickleball or things like that, but you can still get outside, get some vitamin D for your mental health. You can do some short walking, but also to do it amongst other people. It doesn't always have to be about your medical illness or your mental health illness, but getting around people and socializing. And I think that's one of the things we lost during COVID. And so people are slowly getting back to that, but people do need to understand that we are a social society. We do need each other in those social connections for our mental health and for our physical health.
And do you think that patients know that they have an opportunity to have you there for their well-being?
Not always. I think that that's something that we're trying to work hard to bring awareness to, especially within our centers. We're working on the open lines of communication with the medical professionals within our centers and within the community, and just bringing awareness that, you know, we're here to help, whether that's finding you resources or really just letting you talk and be there to listen to you during that time, because sometimes that's all someone needs to make them feel better and turn their day around.
I bet. Allie Thompson and Meredith, thank you so much
Thank you.
for
Thank
coming
you so
in
much.
and talking about social work. I didn't realize they did so much.